Good morning and welcome to our virtual signing event with York University and Oak Valley Health. My name is Jade Maxwell Rodriguez, and I'm the Chief of Government and Community Relations and Protocol at York University, and I'm pleased to serve as your MC for this event. As this event is virtual and we are not all gathered in the same space, I recognize that this land acknowledgement may not be for the territory upon which you are currently on. We ask that if this is the case, you take the responsibility to acknowledge the traditional territory you are on and the current treaty holders. This morning, I am coming from you from the lands of the Mississaugas of the Scugog Island First Nation. As a member of the York University community, I recognize that many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of York University. York University acknowledges its presence on the traditional territory of many Indigenous nations. The area known as Tekaronto has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject of the Dish with One Spoon Wampum Belt Covenant, an agreement to peacefully share and care for the Great Lakes region. This morning, we are joined by Rhonda Lenton, President and Vice Chancellor of York University, Joanne Marr, President and CEO of the Oak Valley Health, and our good friend, Frank Scarpitti, Mayor of the City of Markham. Our first speaker is Rhonda Lenton, is York's 8th president. She joined York in 2002 and has served in a number of roles, including Dean of the Atkinson Faculty of Liberal Arts and Professional Studies, York's inaugural Vice Provost Academic, and Vice President Academic and Provost. She's a dedicated proponent of community engagement and innovative partnerships, such as the one that we are signing today. I would now like to invite President Lenton to give remarks.
Thank you so much, Jade. Good morning, everyone. Bonjour and bonjour. I'm really pleased to be here with everyone to mark what's a really important advancement in medical education and health research in Markham, Whitchurch, Stouffville, Uxbridge, and surrounding communities. So welcome to everybody. Let me just first of all begin by acknowledging my fellow speakers, Mayor Frank Scarpitti of the City of Markham, and Joanne Marr, President and CEO of Oak Valley Health. Just a bit about York. I think many of you already know that we're just over 60 years old. And throughout our time, we have continued to offer a broad demographic of students with access to a high quality learning experience at a research-intensive university, but fundamentally committed to enhancing the well-being of the communities that we serve. And over the past year and a half now, we all know that the pandemic has really highlighted just how interconnected we are. We always understood that we were very well connected digitally, but we really understand now how interconnected we are physically as well. And the complex challenges that are facing one community, whether or not it's inequality or homelessness or climate change, systemic racism or global health crises, they continue to affect us all. Universities like York play a critical role in facilitating and so really supporting the types of collaboration that are fundamental across sectors in order that we can work together to address these complex challenges and bring together researchers, policymakers, practitioners, and experts to foster the kind of discovery and application and translation of new knowledge that is needed. York is perfectly positioned to be a leader in this response, along with our demonstrated history of facilitating multi-sector and interdisciplinary collaboration. We possess significant expertise in those fields of climate change, disaster and emergency management, AI and society inequality, sustainability, and health governance. Indeed, health is amongst York University's fastest growing areas of study, research, and community engagement. We have, for example, new programs in biotechnology and science that will be offered at our new Markham campus, which is set to open its doors in 2023. And that will further enhance expanding educational and research opportunities in health research and innovation. We've also opened up the very first UN training center. They're known as a CFEL training center. Ours is called CFEL York in Canada. And those CFEL training centers are intended to facilitate best practices and expertise around the world so that there's really a sharing and a strengthening of our impact on the UN Sustainable Development Goals. And we're going to be looking forward to using that CFEL York to bring together government and not-for-profits, industry, together with researchers and educators and practitioners to address really these complex issues that are impacting us in those areas of sustainable development, disaster and emergency management, diversity and inclusion, economic development, entrepreneurship, and global health. And earlier this year, we also announced our plans to move forward to submit a proposal for a new school of medicine, which will focus on training family and community doctors in an integrated setting, promoting care both within but also outside the walls of hospitals, in order to, especially with the focus on creating greater health equity for diverse communities across Canada. York University and Oak Valley Health share that common goal of building healthier communities in the Markham region and a long history of collaborating on projects that help us make progress toward this goal. The MOU that we're signing today will build on our existing partnership and formalize our commitment to sharing our resources and our knowledge, to explore opportunities, to collaborate on academic recognition and continuing professional education for employees of Oak Valley Health, the development of research capacity and opportunities between York faculty and Oak Valley Health clinical faculty, clinical placements and experiential learning opportunities for students in nursing, clinical psychology, social work, and healthcare policy and management, to do joint events together to raise awareness of local health issues, and advancements also in health informatics, disease modeling and prevention, data visualization, and health technology. I want to thank Oak Valley Health and all of our partners in Markham and in the region for their continued partnership. And I look forward to continuing to work together to create healthier and more equitable communities. Thank you so much. Merci, miigwech.
Thank you, President Lenton. Our next speaker is Joanne Marr, who is the President and CEO of Oak Valley Health, formerly known as Markham Stouffville Hospital. Throughout Joanne's career, her focus has been on driving transformational initiatives that have a positive impact on the overall patient experience and patient care redesign. It is my great pleasure to invite Joanne Marr to give remarks.
Hello, everyone, and thank you, Jade, for the introduction, and good afternoon, President Lenton and Mayor Scarpitti. I'm absolutely thrilled to be here today to officially announce our partnership with York University. As a healthcare organization committed to provide the best care for our community and our patients, we must make investments in education, and that includes simulation training, research, and other innovative approaches to learning. Our teams must strive not only to be educated about healthcare best practices, but to share and practice that knowledge both within and outside of our hospital walls. And this is why today's announcement with York University is so exciting for all of us. Oak Valley Health recently launched our 5-year academic plan, and the plan outlines our vision to foster a culture of learning, to promote innovation and research, and to build strategic partnerships to enable this vision. So this collaboration sets the stage for a strong partnership that benefits future healthcare professionals and leaders in our region, in our community, and across the entire healthcare system. Providing opportunities for our people to work and to learn from each other in areas such as clinical placements, research, public and community health and education, as well as information system integration, will continue to pave the way for innovative work. And in turn, this will lead to positive health outcomes for our community. We are excited and we're grateful for this opportunity to maximize our shared expertise and resources and to invest in further in the communities of Markham, Stouffville, Uxbridge, and beyond. We also welcome the opportunity to share our Honor to Care culture, which we believe truly sets us apart. Thank you, and we very much look forward to working together.
Thank you, President Marr. I'd now like to invite President Lenton and President Marr to sign the MOU. And then once you have signed, if you could hold it up so we can take a quick photo. All right, thank you very much. So thank you and congratulations. I'd now like to invite our good friend, Frank Scarpitti. For those who don't know him, I'm sure there aren't that many. Frank Scarpitti has been the mayor of the city of Markham since 2006, and he is Markham's second longest serving mayor. The mayor has been an instrumental partner with York University in helping us build our new Markham campus, which is set to open in September 2023. And in addition to his electoral duties, Mayor Scarpitti has served as co-chair of the Markham Stouffville Hospital Capital Campaign, and his efforts have contributed to surpassing the hospital's $50 million fundraising goal. So I'm very pleased to be able to invite Mayor Scarpitti to say a few words.
Well, thank you very much, Jade, and good afternoon to everyone. I'm excited to be here, and I want to thank you for the invitation to be part of witnessing this incredible moment. You know, I looked at the agenda and I thought, okay, I'm the closer, but I jumped to conclusions because actually there's going to be some questions from some young students that we're going to get questions from. So I'm not even the closer, but I'm just happy to be in the room for this momentous moment, and really to say that the city of Markham really worked hard to get York University to build a new campus here in the city of Markham. Why? Because we wanted to build on our capacity for research and innovation. And so this MOU really is something that advances that on so many different levels. As we said, when York announced that they in fact had chosen Markham as the location for their new campus, we said it was going to be a game changer. And fair to say, this MOU between York University and Oak Valley Health is a game changer as well. And both organizations, I mean, York is got a solid record of research. And I know they like to use the word impact. I can tell you that the impact of their research and their capacity, it goes truly worldwide. And Oak Valley Health, well, you know, they know how proud I am of what they do in our community. They have truly demonstrated always, but particularly over the last year and a half, that they have the ability to provide that on-the-ground healthcare that our community relies on while doing great work in research and in clinical trials. So you put these two organizations together, and it truly will create enormous capacity within our community. So really, we're here today, and I'd say I really give kudos to the leaders of both organizations. You know, it's no accident that these discussions really started in earnest not that long ago. And here we are today with the formal MOU signing. And that credit truly is to Joanne Marr, President and CEO of Markham Stouffville Hospital, now Oak Valley Health, and to Rhonda Lenton, the president of York University. Two outstanding, extraordinary female leaders. And that's probably why we're here so soon celebrating the signing of the MOU. And this MOU is going to open doors. It's going to open doors to the faculty, to students, to healthcare professionals, to researchers. And that's a great thing. And really, I don't care who you are today, now more than ever, whether you're a patient, whether you're a healthcare provider, whether you're a member of York University, a medical professional, a member of any level of government, you recognize the importance of collaboration. And truly this MOU is going to change, truly change medical education and research, not just here in Markham and York region, in Ontario, and it'll have far-reaching effects. So congratulations to both presidents, congratulations to both organizations. This is another proud day for me as the mayor of Markham.
Thank you very much, Mayor Scarpitti. I would now like to invite all of the platform party to turn on their cameras to join us as we're going to begin a very short question and answer session with the audience. If you have a question for one of the panel members, please post your questions using the Q&A function in Zoom at the bottom of your screens. We've already received a few questions, and I'm just wondering if I could start off with a question for President Lenton. Innovation is a core institutional value at the university. How does this partnership continue to advance this value from an education and research perspective?
You know, the whole concept for me of innovation has really taken on new meaning over the last numbers of years. And, you know, innovation is like this huge continuum. And being able to think about innovation in academic programming, how you drive innovation through research and application. And at York, we've really been, you know, working on supporting that whole continuum of innovation, you know, thinking about and encouraging new ways of doing things, but then how do you cultivate that entrepreneurial mindset that supports not only, you know, the creative, the ideation, but also that supports the whole continuum of bringing forward an idea through a startup and eventually to a scale up, and, you know, having that entrepreneurial strength and background to be able to do that, to ensure that we're keeping within Canada, you know, that we're actually developing products, we're hanging on to our IP, and that we're investing in Canada. And the pandemic has really demonstrated for us, not that we needed it demonstrated, but the absolute imperative of Canada thinking about how we are encouraging that innovation and that entrepreneurial spirit and investing in our own healthcare system, you know, supporting the labs that are necessary for producing vaccinations. And so for me, this partnership with Oak Valley Health is so incredible that, you know, we're bringing, there's so much rich data and that practitioner experience and the research activities and learning that takes place inside the hospital. And of course, have been continuing to expand our own footprint over a large numbers of years now in health and healthcare, and understand the commitment to offering all of our students experiential education opportunities to cultivate their own innovative thinking, their own entrepreneurial mindset. And so this partnership is going to help us expand the commitment to those clinical placements. And importantly, it's also going to create opportunities for us to work in collaboration on the really important challenges that are facing the healthcare, not just the health and healthcare, but the healthcare system, and how we can tackle some of those problems together, and really then drive the innovation that is going to be necessary. And this can be in areas from biomedical science to psychology, clinical psychology, mental health, nursing, social work, kinesiology, rehabilitation science, global healthcare policy, health management, informatics, technology, the engineering. We cover such a range now within our academic programming and our organized research units. There's just tremendous opportunity. And of course, we're also very eager to move forward with our new School of Medicine, and we'll want to benefit from the input directly from Oak Valley Health, because we have lots of ideas about a very distinct approach to the training of future family and community doctors. So I would say that we see enormous possibility to really enhance that commitment and kind of to move forward together in our goal of supporting high quality, sustainable, inclusive, and accessible healthcare for the local and global communities that we serve.
Thank you for that, President Linton. Our next question is for President Marr. And I'm wondering if you can comment a little bit about the opportunities that you see in bringing together different healthcare workers within the hospital to talk about strengthening interprofessional teamwork and improving the healthcare system.
Yeah, that's a great question. Thanks so much. And what I can tell you is that there is a lot of opportunity. Of course, we'll have focused education by clinical specialty. So by that I mean, and we've heard from President Linton already, all of the disciplines like nursing, allied health, support services, medicine, and of course by clinical area. So areas like emergency, critical care, surgery. From the respective interprofessional education, that really brings together, and interprofessional really means that the learners from various areas actually learn together. That is something that I think all educational arenas, and as well as the providers such as hospitals, really strive for, because we know that care is delivered in teams, and teams who work together need to learn together. So doing that together is also part of our goal and part of our scope. We'll have additional learning opportunities for all learners for things like research fundamentals. We'll use tactical approaches like virtual reality, which is definitely something new in the educational realm, at least for us, and simulation, which has really become the gold standard for learners. So we're delighted to be able to offer simulation labs and opportunities. There will be independent digital learning modules, not only for current learners, but for our staff as well, and skills development and skills renewal, clinics and labs. That's critically important for people in the healthcare area in particular, but not exclusive to frontline providers. And this is, as I said, not only important for the student learners, but also for our staff and our professional staff. We will also be working with, and we are exploring newer models of learning like externships for nursing, but also for other allied professionals, which really helps us to recruit and retain and bring new blood into the system, and also helps health human resources strategy. So in addition, we'll have other technologies for that. We're in gridlock, so that's just our reality. So we'll have other research and scholarship opportunities, including formalized residency placements, not just for medical professional staff, but for all nursing and allied health as well, all as part of our future vision. So those are just some of the offerings and the opportunities we have, but it's certainly early days and we continue to enhance and grow, and delighted about the partnership to help us actualize that vision.
Thank you for that, President Marr. And we have time for one more question. And the question is for Mayor Scarpitti. Could you let us know how you see the diversity in Markham contributing to the work of this MOU and the partnership between York University and Oak Valley?
Well, thanks, Jade, for the question. And earlier I said the MOU is a game changer, and I don't want people to think it's a cliche. It truly is a game changer. As a country and as a community, we've worked hard to attract talent from all over the world. And when you see, particularly over the last couple of decades, we've been so fortunate to attract a very diverse talent, global diverse talent that's highly skilled and highly educated. And this was one of the reasons we worked so hard to attract York University to Markham, because education is a priority for many families in Markham. And so this will open doors for some of that young talent to get opportunities for research, to seek out careers in the medical profession in the broader sense. And, you know, as hard as we've worked to attract a global talent, we want to make sure that those opportunities exist here at home and that we don't have the brain drain where we don't have the capacity to do the type of research in collaboration with healthcare providers, and individuals go elsewhere. And I want to get to another issue too. You know, there is a shortage of doctors in our province, and it used to be that you'd go to places like rural Ontario to witness that shortage. That is no longer the case. We have a capacity issue right here in the GTA. And that is as great as technology allows us to introduce better treatments and to shorten some of the backlog that there is in the system. The fact is, we do need more doctors. And I think this MOU is really going to lead us to a place where we actually can increase the number of doctors and healthcare professionals. And, you know, Joanne talked about the retention of talent. Certainly, President Letton spoke to the ability to have opportunities here at home. And this MOU is going to allow us to do that with the talent that we've attracted, but we very much want to retain.
Thank you for that, Mayor Scarpitti. And I'd like to thank everyone for asking some very interesting questions this afternoon. I'd now like to invite President Lenton to propose a toast to celebrate our new MOU.
I'm going to give everyone a chance to raise their nice cup or whatever cup. Thank you so much, Jade. If you are able, I would ask that everyone raise their mug, their glass, their bottle, whatever you have on hand with the beverage of your choosing. This MOU, you know, represents a new chapter for York, for Oak Valley Health, and all the communities in the York and Durham region. You know, we all share, and it's a real, you know, significant statement, a commitment to improving the health and well-being of individuals, of our communities, and of our planet. And there's really nothing more important that I can think of than that combined commitment. So as we work together to really leverage the lessons that we've learned throughout this pandemic, we're going to be well positioned to advance that high quality, sustainable, inclusive, accessible healthcare that is so necessary to drive positive change and to improve the health and healthcare outcomes of local and global populations. So with that, please raise our glasses. Thank you so much, everyone. Merci, miigwech. Cheers.
Cheers. Congratulations.
Well, I'd like to thank everyone for joining us this afternoon for this virtual celebration. I hope that you all enjoy the rest of your day and you have a lovely weekend. Thank you. Merci, miigwech.
Thank you, Jade. Thank you.